And during the treatment, did you experience a decrease on your health, on your energy?
You know, it's funny because everybody has a different response to the treatment. When you ask, you get close to all these patients, and everyone talks to everyone, and we all know what side effects we all have. Some people, it's like this, some people have none. Maybe they feel a little fatigued. And some people are sick to their stomach from the radiation, even though it's low dose. I have shoulder pain, I had shoulder problems, and fatigue. But we're working on the shoulder now that my treatment's done and now that I'm cancer-free. So I'm hoping that will recover back to where it was. And the fatigue, I think, is just a matter of the radiation. Yeah.
Were you able to continue your normal life? Were you working at that time when you started the treatment?
No, I wasn't working, yeah. I took some time off because it's every day, Monday through Friday. I couldn't go to work.
Did you exercise?
Yeah, I did mild exercise. I think I did mild exercise. I did change my diet. I took out all the refined sugars, all the caffeine, any type of white flour, and things like that. You know, added a lot more fruits and vegetables.
Do you think that helped you?
I think it did. You know what, I have to tell you that I think my immune system was already doing this. And so I was already in trouble. I had a lot of stress. I had some, personal issues I was dealing with. And all those things combined a perfect storm, I think, for the cancer to incubate. And I had a chronic sore throat for 4 years. 4 years. And when I found it, and I went to every ENT, ear, nose, throat doctor, and they wanted to cut out my tonsils, but they didn't know that would do it. So I said, absolutely not. We're not going to try. It's not a trial run here with my body. Let's just cut off a part. Yeah, so I didn't do that. But for 4 years, I had that and really chronic fatigue. And when I found out I had the cancer, for 6 days, that's it, 6 days, I juiced fruits and vegetables, didn't eat anything. And in 6 days, it was gone. 6 days.
God.
Days! People have cured their cancer with just eating raw. People have done it, it's just all different alternatives work for different people. But the reason that I really needed something is because I knew I had HER2 positive, estrogen positive, stage 2 breast cancer. And I knew it was the aggressive type. And I didn't think the diet was going to do it. I thought it needed something else because it was taking over. And if I didn't kill it first, it was going to kill me. And it wasn't responding to diet, and it wasn't responding to nutrition. It just wasn't. And I had revamped everything. So it just wasn't going to. I knew I needed something else, just something strong.
You see somebody on the street with breast cancer. What would you tell her?
Well, like I said, I think there are many alternatives and, a lot of things that would work for different people. And so, I would tell them to start with the least invasive thing. And that's the thing is, cancer patients, the conventional doctors make you think you have to do it tomorrow. You don't have any time. You have 30 seconds and you need to make the doctor's appointment for the surgery. And it's not true. Breast cancer's been developing, by the time you find the lump, it's about 5-7 years. It's already been there. So it's not going to happen tomorrow. Nothing's going to happen tomorrow if you don't, if you take a little time to try and fight it alternatively. And, if it were my own mother, I would have her, drastically change her diet. I'd have her, start doing alternatives, maybe the juicing and raw and all those things first to try the least invasive. If that doesn't work, then like I did, I would, have her do her or a stranger or whoever, then take the next step to do something like, like the cryoablation or like hyperthermia and low dose radiation. So, because you want to do the least invasive. No one wants, I don't want probes in me for the cryosurgery, and I don't want radiation, but if that's what it takes to stop this thing from growing, then that's what it takes.
And you do have choices.
Yeah, and you do have choices.
You do, so it's great that you went with your gut feeling.
Yeah.